morning, Tri-Cities. It's Friday at 9, so it's time for Coffee with Karl. This morning, I'd like to welcome our guests from the healthcare community. We've got John Solheim, who is the CEO of Trios. Good morning, John.
Morning.
And also Riza, I think, is coming on. If you could turn your camera on, Riza. Riza Khalil is the CEO of Kadlec.
Hey guys.
Oh, well, we can't see you. I don't know if your camera came back on, Riza. Can you hear us?
I can hear you. It shows that my camera's on.
Yeah, I see him.
You see him? Okay. It might just be me. That's not the first time. There he is. I can see him now. Sorry.
All right.
Isn't technology great? It seems like in the, the world of the Zoom meetings that we all live in, and until somebody doesn't turn their microphone on or something, it's not a real meeting, right? It's like you got to cross that barrier before you start off. But thank you both for coming on this morning. Looking forward to a good discussion. Just, really a check-in with both of your organizations on how we're doing on the healthcare front with COVID, and then, maybe some things that are coming up. We'll start off with our coffee or mug story. And I got this one from my daughter, whose birthday is next week, and I didn't have it last time we talked, but it's actually Jabba the mug, or Jabba the cup. Sorry, Jabba the cup. So for Jabba the Hutt. I know last time, Riza, you had a Star Wars one on, so I thought that was a good tie-in for today. So, John, what do you got this morning?
Not much. I got a plain vanilla cup because it's Friday, and just thankful that made it through the week again. So it's just all pure plain vanilla. As long as it's got hot coffee in it, I'm good to go. So not very imaginative. I apologize.
No, not at all. It's the best kind of cup there is. One's got coffee in it. Riza, how about you? What's your mug this morning?
I've got a mug that one of my coworkers gave me for, I think it was for my birthday last year. Everybody around here knows I'm a big classic rock fan, so this is Freddie Mercury. From
Nice.
mug.
Wow, that's pretty cool.
Yeah.
Well, let's jump into it, and maybe I ask both of you just to give an overview of how's it going. Let's start with John, and if you can. Oh, I do want to point out too before we get into it. Chad Pugh from Lourdes wasn't able to join us this morning. He had a pre-standing meeting, so we'll have a future episode where we'll be able to get Chad on. And then if there are any questions that come up from the audience, if you're on Zoom, you can ask it in the question and answer feature. If you're tuning in on social media like Facebook, you can put your question in the comment section, and then we'll work into those as we go. So let's go to John. And John, how are things going at Trios?
All right, thanks for the opportunity. And again, we're always happy to kind of talk about the process in the community, because we're kind of the, healthcare is one of the last frontiers. Kind of, again, just a reminder that even though there's a lot of positive cases it's the number of hospitalizations that we're all managing. And so overall, our volume has peaked up a little bit, but not substantially. And I think in the community in the last couple of days that the hospitalizations have dropped a little bit, but it ebbs and flows. And so I think that's the art of managing that. And then it's managing the what if that's coming down the line and being prepared for that. And so a lot of our time is spent preparing for that process. But overall, I can just tell you our staff is tired. They working across the board, although we have outstanding providers and nurses. I just want to make a point that we have lots of other people that go into COVID positive rooms, like environmental services, respiratory care, pharmacists, and it really takes a team. And often the providers get the most credit, but it really takes a team to put it together. And I'm super proud of their work that they do and the people that support them behind the scenes. And then secondly, I just think it's with working parents and being essential workers. I just, again, shout out to all that they do to come to work every day when schools are closed and family members are sick. They just have this ultimate kind of mission of serving people, and they are willing to prove that by coming to work every day. So to have my gratitude for their willingness to do that every day, and hopefully we support them. But I think the Tri-Cities, at least in our health system, we've had the longest sustained COVID patients in our hospital. Other places have spiked up, but it's just been a constant process. So we are good on PPE. We've got good allocation. We appreciate our system supporting that, but also the state's been able to come through with some PPE for us. So we monitor that burn rate every day. And for the most part, we've been really solid. We haven't had to go into a reuse process yet, but we're planning for contingencies there. So I think the biggest issue is just finding staff. We do have some staff members that are getting COVID, mainly, or mostly from the community, relatives and friends, and, just trying to manage through that. And, even in our size, even losing 1 or 2 nurses or 1 or 2 respiratory therapists out is problematic for us. And so, again, other staff have dutifully stepped up and helped in that process. So it's just we continue to wage the fight against it, but really thankful for the people and the community support that they have provided to our staff and thankfulness is very important. So that's our update. Appreciate it. And same with Lords. My colleague wasn't here. Lords would say the same thing. So we work really closely together, and they're also thankful for their staff.
Oh, that's great. Thank you, John. How about Kadlec? How are things going? And it's kind of an overview of the current status.
Yeah, I think John summarized, I think what healthcare in the community is going through pretty well. So a lot of real similar dynamics here with folks being tired and whatnot. I think, as we look at our numbers right now, we haven't reached, in terms of just the total number of COVID positive, we haven't quite reached the same peak that we did in the summer yet, but we're seeing that trajectory, and everybody's experiencing a little bit of trepidation about what the rest of the year is going to bring with the post-Thanksgiving bump, and hopefully people will be careful over the Christmas and New Year's holidays. But every time we've seen a major holiday, we've seen a bump in numbers, as most people know in the community, followed by a bump in numbers and hospitalizations. So we're playing out the timeline, and a little concern there. Another big difference, I think, right now between what we saw maybe in the spring and the summer is, as the community spread continues to go, we see not only positive cases, but just cases where we have more and more people having to isolate or quarantine at home due to exposure, because our caregivers are all part of the community like everybody else. So it's hard to say. We often get asked for these very specific numbers around things like that, and it moves around all over the place, and depending on who it is in your workforce that's exposed, if you've got administrative workers that need to quarantine or be at home, it's a little bit less of a hardship because they can work virtually like this, things like that, versus say a frontline nurse or nurse's aide or a technologist or an MA or somebody who has to be out here. As John expressed, there are so many people that go into providing care for folks, from EVS workers and facilities folks and sort of you name it, that it's hard to do without any one of those folks. So we're challenged with that at the moment, and hope the community will continue to be mindful of that as we go into the next few months.
Oh, that's a great point. I think you both did a great job in pointing out that, and we've talked about this on other, this isn't broadcast, it's not an episode, but other Zoom meetings that we have on Friday for Coffee with Karl. But
can people binge watch Coffee with Karl?
They actually can. Go to our website and you can check out the whole series. It'll be just like you're right here in our bonus room with us.
Awesome. All right. I'm going to go back and rewatch Game of Thrones and then Coffee with Karl all the way through.
I think you'll enjoy the Star Wars series a lot more than the Coffee with Karl. But how much responsibility each of us carry in following the guidelines and not going to big groups and not being unmasked and doing the things, because we just think about sometimes ourselves, but it really has this ripple effect on the whole community, and workforce is a great one. When we were working on some of these CARES Act grants that we helped out with both counties and some of the cities and with Department of Commerce, when you talk to employers, a lot of times that's just the case. When they have a workforce that needs to go to work and their spouse has to quarantine because they came in contact, maybe even at work, from somebody that didn't, maybe get COVID at work, but they brought it home from a thing, it does have this ripple effect. And I think that's a great point, where it's not just someone, because people generally aren't getting sick at work. It's the things that they're doing at home and then bringing it to work that I think we're all suffering from a workforce standpoint. We've heard that from many different employers for sure. How about maybe talk a little bit about, and I asked Riza this before we came on, and he got into it a little bit, but bed capacity is one of the things I think the health district monitors, and how are we doing as far as that. And I don't know that it's something that gets out there as much as maybe this summer when we were trying to come to a reopening phase or something, but how do all the hospitals work as far as maybe sharing bed capacity? And then, each individual healthcare center might not be as important as like this regional aspect. And I don't know, John or Riza, toss up either one of you want to take that one and give a little more explanation, or, kind of what those numbers mean and how you look at it collectively.
I'll let Riza start and I'll follow up.
Okay, perfect.
Well, I think there's a lot of coordination going on with the state right now. And we were just talking before we got on here, and John and I were on a coordinated call with the hospital association, with all the Eastern and Central Washington hospitals, just giving updates on where they are with capacity for various reasons. And I'll just say the general public, I think, sometimes doesn't get, by looking at those stats that the health district puts out, really a clear idea on how bed capacity is determined. And so I'll just throw out a few things that are typical hospital concerns that we look at. Number one is, it's not just the beds, obviously, it's, do you have staff, as we're talking about people being out of work to staff those beds. And so as we look at different types of beds, whether it's ICU beds or regular med-surg beds and on, do you have staff available in order to staff those beds? And then do you have staff available? Another example is, John brought up EVS earlier when talking about all the important folks that go into this. Do you have environmental services, housekeeping staff to turn the beds over and clean them? And of course, with COVID being here, the cleaning processes and all of those have become much more tuned in and dialed in to ensure that we're being cognizant of all of that. So I think when we look at available beds, physical beds is probably the least of our concerns, quite honestly, at least here at Kadlec. And as I listened to our colleagues on the call last evening, it seems to be the same everywhere. It's really staff for those beds, and how many staff do you have? How burned out and tired are the staff? How many staff do you have that are maybe available but not available because they're quarantined or whatnot? So those are some of the things we look at. And the last thing I'll say is it waxes and wanes throughout the week. So I could tell you a situation looks like something today, and over the weekend it may completely change, and on Monday it may change again, because all of those factors are pretty fluid.
Oh, that's great.
Yeah, I think those are excellent points. It is variable, and I guess the main point I'd like to make is, we focus on COVID, but this is the fourth quarter. Traditionally in hospitals are busy seasons for a variety of reasons, and often we just think about COVID, but what I think about is making sure we have capacity for people with heart conditions or other conditions, and we have to be open for everybody. And the COVID is important, but it's a small percentage of our total care that we provide, at least at this point, but really across the state, and we tend to focus on that. And so we just want to say that we're open for everybody, and the hospitals is one of the safest places to come. And we're seeing people really delay their care because they're just afraid. And all our staff at PPE are very well protected if patients come in. So I just want to put a note out that we just have to be open for across the board. COVID gets attention, but frankly, my friends, families, and neighbors that have heart care is just as important as treating COVID patients. And so for our community well-being. And so I think that's what Riza and I know Chad and Lord struggle with, is how you balance all of that together and not just say we're all about COVID, because we're not. We're about all patients that come through the door, regardless of where they are. And I think because of our proximity to Oregon, it's not just Tri-City. Riza certainly, Kadlec gets lots of regional referrals. We get referrals in, and they're from neighboring states. And so because of our geography, we really have to focus on the broader picture. And we've had good support from the critical access hospitals that surround us working together. They have the same struggles. And so I just want to note, hospitals are safe, but boy, we really focus on all of the patients come in, not just COVID. And I just want people to realize that if you have concerns about heart care, come on in. I think Riza pointed out earlier too is, you know, if you have COVID, instead of just coming to the ER, our symptoms, call your primary care doctor. There's other protocol that we can help rather than stacking up our ERs with potential patients. And you made a very valid point that could expose you even further. And so call your primary care, call your clinic. If you have symptoms, get tested in the CBC and all that before just showing up in the ER, because that's probably that helps, that attributes to the clutter that we have in there and processing people through. So again, you know, it's fluid. That's the art of managing this. Again, it takes a team effort, and the state of Washington really is, we have a compact with all the hospitals agreed that there's no wrong door. And that's was evident last night, working together with all from Wenatchee, Yakima, Spokane, and the Tri-Cities, all working together to try to serve the patients. But COVID gets you attention, but there's lots of other conditions that we want to be available for.
That's a great point. Are you seeing, or I don't know if you guys track this, but are you seeing people that come in, like say with a heart condition, that maybe because of COVID, they've delayed treatment, or they were concerned about, you know, accessing healthcare? And so do they come in, I don't know if it's a term to say it, are they sicker? You know, like in normal times, maybe they would have come in earlier. Are you seeing that? Or anything to track?
Riza can talk about Kadlec, but yes. So the biggest thing with us is our ER numbers are down, but when they come to the ER, our admission rate is dramatic. Our case mix index, which measures how sick people are, has gone through the roof in the inpatient units. So I don't know if we can, you know, a pure de facto correlation, but the reality is people coming through the ER, the numbers are low and the admission rates are high. And as a result, we've had to keep people in our ER longer than we want to, just because we're managing bed capacity and don't want to send them out of the community. That's the last thing any healthcare provider wants to do. And so we're seeing that, but I don't know the breakdown if it's more heart or others. I just know when they come in. So we have a lower number, and the ER doctor would say to me, he goes, yeah, we had lower numbers, but it feels like we had double that, because just the intensity of the care that's needed to be provided is way up. So, and I'm sure, Riza, you've experienced similar things at Kadlec.
Yeah, very, very similar. And you know, anecdotally, we hear stories about individual patients who come in, and then, you know, we hear that, oh, they tell the doctor or someone else that they've been putting it off because they were worried about COVID. And then in the data, as John said, we have this case mix index number that measures the relative acuity of the whole population of patients we see, and that number is way up for us. And I think the implication of that too, if you go back to the staff and what they're dealing with, and we, you know, like every other business, we've got these productivity statistics that show, you know, on average how many staff you need for so many patients and all that. And that starts to, you start to think about that differently when you're thinking it's the same number of patients, but the patient population looks different. And I've one thing I may be helpful to clarify here, I've heard even in the last week, some people unhelpfully throwing out a statistic looking at our total census at this time last year and our total census currently, and saying, hey, look, you know, you guys aren't any more busy than you were before. And sort of the retort to that is really, well, the number of patients may be the same in the hospital, but they're sicker. We're working through all sorts of protocols with PPE and managing infectious disease that make people's jobs quite a bit more stressful. You've got a much more tired workforce. You've got less access to staff that same number of patients in all the ways we've been talking about. So in no way does that reflect, hey, this is the same as it was a year ago or the year before that.
Yeah, no, that's a good point. And I think, again, it's related to COVID, like you said, because there is concern about accessing healthcare and, you know, just people not knowing. I think that's what we're all collectively learning, you know, relatively quickly, is that this is a pandemic. We've never gone through it. So, you know, we definitely don't have that. I don't know if there is such thing as a societal understanding of a, you know, a disease or a healthcare risk, but when there's unknowns, you're seeing this huge spread in the spectrum of people's reaction to it, right? Like some people revolting against doing anything different, like wearing a mask or, you know, these other things. And then over here, people that are just very, very cautious and, you know, maybe they might have another healthcare issue that they're afraid just because they don't know, not because. And so I think that's something important to get out, is that if you're sick, access healthcare. And if you think you have COVID, don't necessarily go to the ER of the hospital, access it through other ways. And I think we talked earlier about telehealth, which I know our families access that. And, you know, like our insurance companies trying to send us emails and saying, hey, access telehealth. And there do seem to be more resources in that area. Do either one of your facilities, do you guys or your physicians participate in telehealth, or, you know, is that something that is done locally, or is that more of a national thing? Are there things that you guys do with telehealth?
Yeah,
Start off with Reese this time. Sorry, I didn't ask that specifically.
Riza will jump in. We'll trade off every other one.
Okay.
So I'll let Riza go and then I'll follow.
Okay.
Yeah, we have a tremendous amount of activity going on with telehealth. Everything from having converted, like you've probably heard with a lot of the physician practices all over the country, converted a percentage of our physician office visits, primary care and specialty, to telehealth visits, to things that we do on an outreach basis with a lot of referral rural hospitals in the region, that we have specialists available that even before the pandemic were doing a lot of things. So we had a fair bit of telehealth going on prior to all this, and we've just seen that really ramp up over the last 10 months.
Okay. Yeah, similar. We do telephonic and televideo, and then I think there's been some relaxing of insurance guidelines to get that compensated. I think, you know, it's not a fix for all those. So that if you have complicated stuff, you still have to come in. And I think it's just not a panacea that telehealth solves all ills. It doesn't. It helps with the percentage of people that come in, and it's very effective and very helpful. But others, you know, you still have to come in and see your primary provider or a specialist. And I think so. It is another arrow in the you know, your quiver to address that, but it doesn't solve everything, and we still need that face-to-face time with your provider. Certainly we have, again, we check temperatures of people coming in, we ask if they have symptoms, and again, if people are comfortable, again, very safe. All our providers have masks, and staff have masks, and are protected with eyewear and other things to make sure that they can continue to provide care. So if telehealth doesn't work and you need to come in, certainly there's lots of ways that you're protected and the staff are protected when they come in.
That sounds good. We do have a question from the audience about telehealth. And are you getting any feedback from, you know, either the doctors, the providers, or patients about how it's going? You know, do they like it, or any general feedback that you guys are hearing about those telehealth programs? Maybe this time we'll start with John.
Yeah, so it's mixed.
Yeah.
It depends on who you are, and maybe age category or symptom. And so for simple symptoms, it's beautiful. They love it. It's quick. Provider likes it. Others sometimes want to do more than really can be done over telephonic or televideo, and they have to come in. So I think overall, it's a nice alternative. It just doesn't solve everything. But the ones that have tried it for simple symptoms, I'm sure like your family, that is fantastic and quick. The providers feel comfortable doing it. I think if you're a new patient, it's more difficult. If you're an existing patient, it's a whole lot easier to do, you know, telephonic, televideo, because there's that history. And I think that's what our providers, it's great for existing patients. New patients, a little tougher. And they're a little more conservative on that as a result of that, because they just want to do the right thing. So
you bet. That's a good point. Riza, how about you? Any feedback on the telehealth program?
Nothing to really add to what John said. Similar for real low acuity, simple stuff. It's a huge satisfier for convenience and all the other things.
Yeah. You know, as you guys were both doing a great job of describing like your whole team, you know, that it's not just the actual providers, but it's this whole team that you have both at your facilities that are, you know, really have been dealing with PPE and all these kind of added stressors. How are they doing? And you know, like as in both of your roles, have you been able to implement anything, you know, to provide additional supports to your team members? Obviously, like you said, this is a different situation, maybe more stress, anxiety, hours potentially. I know even, you know, people like our small team that are working remotely, you know, and you read all the articles, like living in the effects of COVID in so many different ways. There's different things that we all have to deal with, but you guys adding any support mechanisms or help for your team members, or, you know, anything like that, or even any ideas related to that? Maybe this time we'll start with Riza.
Yeah, you know, even prior to this happening, we've had a challenge with healthcare and burnout for a lot of different reasons. And you hear this term compassion fatigue, and that's certainly been a big issue. So we've got quite a few resources. I'm grateful being part of Providence that have been brought forward this year. You know, mental health counseling services, lots of things we're trying to do with just being flexible as possible. And it's very department specific, but with people's work. So we've talked about virtual and at home, and to the extent that people are able to work virtually, trying to really accommodate that, looking at folks that have kids in school and trying to work with them on their schedules and all these things, which of course becomes very hard and the more acute the need for staff becomes. But the thing that I regret that we can't really do right now until we're out of the situation with COVID is trying to really be with people in the way we're all used to. So as much as we still try to be on site at the facility and do a certain amount of things in person, I think it's very, very hard to connect with folks that are struggling in the same way as we might, you know, getting a team together to have a focus group discussion in a room together about something. And so we're doing a lot of those things. And then just one of the most important things for me has been doing the best we can to keep everybody informed of what's going on. So we have this cascade of weekly and sometimes more often communications that go out about whatever the latest is with the situation. Unfortunately, we've had, I can't even count how many different changes with the situation throughout the year with our different protocols for visitors and PPE and this and that. So trying to keep that as simple as we can, but still getting it out on a regular basis. And we've got a all employee forum, all caregiver forum coming up next week, just to update everybody on sort of what's going on with the organization and going into next year and things like that. So trying to keep communication as fluid as we can as well. And then a little bit of recognition. We've done some things that we've not been able to do in the past or not wanted to do virtually. We usually have an all caregiver recognition banquet for years of service at the end of the year, and we can't do that, but we're trying to move all those things to virtual platforms and not just not do them, because they're important, and continue with all of that.
Yeah, you bet. John,
Yeah.
how about you with Trios? Yeah.
Very, very similar, and it's a real challenge because the healthcare is all about people, right? And so you go into it. Otherwise, I think Risa and I would be at a corporate headquarter, you know, at remoting in. So it's about connecting with people and the mission that they provide every day, and that's the fun part. And frankly, we do a lot of social stuff pre-COVID that get together. It's usually surrounded food, and you know, we can't do that. And so now it's just providing some distribution up to the floors or to the departments on food. And again, like Riza, we had our year-end banquet that we honor our recognition of our service employees. We're going to look at a virtual event, but we also have done some things like the 25 days of Christmas, where we bought a bunch of gift cards from the local businesses for food and other things, so that we can kind of combine recognition, but yet supporting local community. And so we try to kind of do both of that, because I think what weighs on the resiliency of our employees is not so much the day-to-day, but what is the effect on the community and their friends that are in service industries and others. And if we can do a small piece on helping that we've been able to do that. And I think there's been people are feeling good about A, to get recognized, and B, to know that they can then serve a local businesses which has it. But it's certainly difficult, and that's why I'm in a community hospital, is that you can connect with that and the patients. And it's been even tougher when we can't always have as many visitors as people want, you know, in the room or in the ER because of obvious reasons. So it's a struggle, but again, because we're so people orientated, I think that weighs heavy too. And you know, people like to get together in breaks just to have de-stressors, and you know, you got to really encourage social distancing. So that's been the hard part, to say, hey, you need that time, but you got to spread out and and healthcare is used to getting together. We do our morning huddles now via telephone instead of getting together with all the leaders. That used to be a good check-in and pre and post conversations that are more organic, that help, support people. Now it's telephonic, and that's a problem. We do our weekly leadership meeting the same way. And so we miss a lot of that. A lot of stuff happens organically in, as Risa said, in that people to people contact. And so we just, emails don't cut it. We got to figure out other ways to get out and do it. But again, I'm doing some rounding in it with, with PPE, and staff are liking that because we just need to show them that they are very important and we care about them. And oftentimes in healthcare, that's face to face. So that's the biggest challenge for us.
Yeah, and I really appreciate your program where you guys are buying the local gift cards. I mean, that's stuff that we've talked about before, is that, especially with the governor's latest orders, anything we can all do to support local business, especially, restaurants and ones that have been affected by this last one. And I think that's a great explanation too, even when we're talking about quarantining of staff, that, we don't have silos around industries, because like, we're people, right? And we're families and we're communities. And so this spouse may work in this industry and this one may work in this industry. And so, when something like a quarantine happens, or even a shutdown, because of the governor's order happens, it affects families. And then, we all bring our family stuff potentially to work. So that's a great point, that, we really are all connected. And we talked about it before. I'm, the new guy to the community, but Tri-Cities community just has so many examples of coming together to do this. And we all know, and we read it in the paper and stuff, of, ideas or thoughts or things that people are doing beyond that. But I think really the core of our community, understands that. We know how to get through hard times, and, it's been a pretty long, hard slog through COVID, but, I'm optimistic. I think we all are, that, there's things are going to get better. We're going to, take that next step. And maybe that's our next topic, is COVID vaccinations. And I again, when we were getting ready for the show, I brought up vaccinations, and Reason made a joke like, what, it sounds like from his explanation that you guys are pretty in depth on vaccinations and planning and all that. So maybe that's our next topic. And we'll talk about John and how's Trios, what do you know about vaccinations, and kind of what's your plan on deployment? And obviously a lot of your workforce is going to, I think, on the first tier of actually getting vaccinations. So you want to kick us off on a vaccination talk?
Yeah, it's certainly evolving, but I think there's good news on the horizon, at least with Pfizer and the FDA approved. And we also are waiting, the governor, or the Western Compact of Governors, has taken additional staff. They have to review it in addition to FDA. So that's slowed it up, but we're ready. And, again, the Tri-Cities is very blessed. I know Kadlec and Trios both have the, I call it the sub-zero freezers that can store the vaccines. Mm-hmm. Otherwise, you got to use dry ice. So I think we're one of 23 sites in the state of Washington. So we're very blessed on that. It appears that we can get enough doses for our employees and providers on the first round. Our key with that is really providing information. There's so much misinformation on it, or historical, or, bias. So providing information for the employees, we are not mandating it to have, but we want to give them information so that it's there. We're hearing very positive people, but just like the flu shots, we don't always get 100% either, based on people's beliefs or, conditions. And so it's something to monitor. And but we're thrilled that hopefully next week or the week after, we can get our employees vaccinated, and they'll hopefully get approval and they can be shipped out. But again, that extra step that the Western Governor Pact has had is going to delay it an additional week. So what you're hearing on TV is different than what reality is in Washington. But the good news, it is coming. That is the first step, and Modia is the next one. There's the efficacy looks really good. We're not sure how long it'll last, but if it gives a time of period, there's a lot of unknowns. And I think as a mass vaccinate people, will find out more about it, because I think the trials had more than usual to get approval, but there's also variables. People are different. And so it's very positive. And again, that's a nice option, just like it's another option to protect our employees, and then really the vulnerable in the nursing homes and the staff. But I think that, like everything else over time, is the way to go. But people have to make their own choices, and that's certainly the same for ours internally, but we're encouraging it and providing information the best that we know, but it's evolving every day too. And Risa made a good point. I mean, it changes every day and just keeping up with that. But again, we're so thrilled that we're able to have that in horizon for the month of December.
Oh, that's awesome. Risa, general topic, vaccinations, go.
Yeah, I just heard that it was a vaccine from Karl this morning, so I had no idea prior to that. No, we're heavy into logistics planning, so we've got like John was saying, this is sort of day by day getting updated, but we think we'll have enough vaccine for probably about half of our staff. So we've been going through a process. We've got a virtual tool we're calling the Validate and Verify tool, gathering some information from everyone to understand who the folks are that have the most exposure at the front line and might be at highest risk. And we're trying to, so if you think of the prioritization funnel you cut, there is no necessarily federal approach. There's some CDC guidelines, and then every state is coming up with their guidelines. And then within our organization, we're going to have our own guidelines to funnel that to the people that we think will benefit the most from it. So beginning with folks that have the most frontline exposure to patients that may be carrying the virus. And then we've got a whole plan that we're sort of hanging on to hear the latest and greatest when we'll be able to implement, but a way to safely route those caregivers in cohorts through that. And one of the concerns we have is when you look at the side effects, I think the vaccine is very, very safe, but like with other vaccines and things, there's been some things where people might spike a fever for 12 hours following the vaccine, or they may have some soreness or achy joints and things like that. And some amount of that is going to cause people to call in sick from work. So if we were to vaccinate our entire staff all at once and have 20% of them having symptoms and call out ill the next day, that obviously would not be highly desirable. So we're trying to work through all those types of logistics to make sure we're optimizing our staffing and not doing this in a way that's going to create an even bigger problem in the short term to solve the medium term issues. So we're excited about what's next, though. It definitely is a light at the end of the tunnel, and knowing that you know, the cavalry is coming, but it is not here yet, as I think I've heard Dr. Fauci say. So we've got to hang on a little longer through this.
It's a good point. And I just thought of, you talked earlier about PPE, you both did, and obviously your frontline caregivers, and then either other staff that need to access PPE. So is there any CDC guidelines on once you're vaccinated and you work in healthcare that will your employees continue to use PPE even though they're vaccinated, or is that more related to kind of like the infection rate coming down or something? Like, what is that part of your conversation too, or how does that work?
We don't
John,
have any plans.
so I'll ask John.
We don't have any plans to change that in the immediate
Okay.
term. There's more to come on that, but it's
Gotcha.
business.
Yeah, no, it probably wasn't very
Same
well
with us,
phrased as a
no.
question, but yeah, I mean, I was just thinking like, well, if you're vaccinated, but then it takes a while to develop the immunity and they're still unknown. So I would assume you're going to keep up the PPE, but at some point in the future, as a society, we'll either get enough people vaccinated or have enough immunity that frontline workers in the hospitals won't have to wear PPE as we come out of this. But that's kind of a point yet unknown. It sounds like that when we don't know when we'll cross that goal.
Exactly. And the flu shot is an example of that. We still, in certain circumstances, even though you're, vaccinated for flu, you gotta still wear PPE for certain patients' conditions and protection for infection control. So I don't think we'll ever get away from it. Well, the extent of it for others that are wearing masks and others may be a different outside of the caregiver, but we, as Risa said, we have no plans to change that because it's still too new.
Yeah.
But the good news is it'll help tremendously.
Yeah, no, for sure. What about, and I think that with many of our guests, we talk about this, but like maybe let's get into the future, even past vaccinations and post-COVID. Do you see any changes coming in healthcare that are either like lessons learned from COVID or, something else. I think, we generally talked about it in the business community that, there could be some big changes in business travel or do we have to go face to face with meetings as an example, on a regional or national basis or something like that. But do you see any general trends or predictions, as we come out of this within healthcare that, something's come up with COVID that we didn't see going into it and something's changed and now, there might be longer lasting change in healthcare? We don't have to have any basis of fact. We can just predict or guess, I guess.
Yeah, good question. I think there has been some efficiencies gained during it out of necessity, and whether they'll continue or not. And, we talked about business travel and those are good. I just think there's a lot, again, organic conversations that occur outside of meetings that really are valuable to our leaders as they go to education. So that'll be a real balancing act to see if the juice is worth the squeeze there as you're traveling all around. Sometimes it's a resiliency break to get away too. I'm not sure, flying to Nashville is that for me, but it might, some other exotic location it might be. But so I think it's just something to look forward. But certainly, there's been some efficiencies gained. I think telehealth, televideo is here to stay, and it was before, but it now is a greater opportunity for people to utilize. But I just think just difference of how we take care of ourselves in the community, and hopefully in the future we'll react faster to personally take those accountabilities faster than perhaps we did because of the long-term shutdowns and those. So I think there's everybody, it all comes down to personal responsibility and your threshold for that. And I think in the future you might jump on that sooner than later as a result of that. But that's up to each of us to determine.
Sure. Riza, got your crystal ball out? You can predict the future?
You want to know what I think will happen or what I hope will happen?
Your choice.
It's been interesting on the regulatory front to watch. Healthcare is notoriously and rightly so, on some levels, very, very heavily regulated. There's all sorts of things you have to do and hoops you've got to jump through to make even the smallest change. And what we've seen this year is the regulators really helped us to take some of those barriers down to do things very rapidly, like implementing telehealth visits more quickly, like being able to do some things that allowed us to care for COVID patients in ways that we just weren't set up to do initially. And so my hope is that there's some learnings from that say, hey, from a regulatory standpoint, there probably are some things we can be doing that'll benefit healthcare for folks that we can do faster, better, cheaper, and make some motion on that front. I've been wondering too, we're having some discussion about some facilities renovations and expansions and updates and things like that. And I've asked our team to sort of think about some of those things through the lens of COVID, and what have we learned about the way waiting rooms ought to be sized and flow needs to be structured that maybe we weren't thinking enough about prior to this. What have we learned about HVAC systems and things that we need to be thoughtful about with that for the next time something like this perhaps happens. And then one thing I hope will happen, and I don't know that we know enough yet. I guess we'll see what happens as things go into the new year. But public health, I think, has really gotten diminished to the point where they have not, even prior to this, probably had the resources they needed to really engage in the ways they would like to. And then through this year, unfortunately, you've seen a lot of the folks within public health attacked and for their views or their efforts and things like that. But my hope is that the public health infrastructure and our ability to partner with public health, which has been great. I've got a shout out to our health district here. They've been just such great partners through this difficult year. I hope that starts to improve. And you kind of see, if you look at some of the data and in some of the Asian countries that have been through H1N1 and some of the more recent, in the last 10, 20 years, things there that have gone through this drill with the masking and everything, and we're a little bit more conditioned to it when things got bad and their numbers have been very, very much lower and more controlled. I'm hoping that the learnings from this of what's worked, what hasn't, how we can do this better the next time. Hopefully not anytime soon, but if there's another one of these, that we can just all approach it with the benefit of hindsight and some learnings.
That's a great point. As we were talking about this, in my mind, I was just thinking of before COVID, when you'd be traveling or something, and you'd see somebody wearing a mask, you were kind of taken aback by it, like, oh, are they sick? Are they, and I think there were a lot of folks maybe that had traveled through, the Pacific Rim, to your point, Riza, had just picked up this public health thing of, if you're sick, wear a mask. It's the thing to do for other people around you. And I just wonder about, to your point, coming out of this, I mean, is that a collective learning maybe that we've got? And I wonder, just in the regular flu season or this time of year, will we just generally see more masking because maybe there has been this public health lesson learned, and, people are more cognizant of that. That'll be, it'll be interesting to see, because it was a change. I just remember, traveling right before we got shut down and just seeing more people wearing masks, and you just kind of notice it without being aware of it, I think. So yeah, that's a good point. I mean, there could be a lot of those changes coming on. And I think I'll just say on the public health thing, I said it before, but I just remember when I was in college a long, long time ago, and lived in a fraternity, and everybody slept on a sleeping porch, and we had to have the doors and windows open. And, it's like, why do we have to do that? And nobody really knew the answer. It was just like, no, that's, you got to follow the rules. And it really came from the last pandemic we had, right? Like, that was a thing that was learned in the 1918 flu, was you need ventilation. And so there's this public health standard that if you're going to be in this situation where, so many people are sleeping in a dormitory together, you got to have the window open for ventilation. And I mean, you wake up, somebody have kind of a snowdrift on their bed and stuff like that, but it was just the thing that you had to do. And it relates back to that public health learning. I mean, that's an example that I can think of, but I think you got a great point that we've collectively lost or lacked an understanding of the role of public health that comes out in a pandemic. And I think, to your point, we've all had interactions with the health district, and I think they're doing a really, really good job. But because there's not this understanding of their role, I think there's a lot of confusion and, everything else that's going on, that people have different opinions and stuff. And so I think it's going to be interesting coming out of that. But I think public health, you're exactly right, that there is such a critical role, even beyond pandemics, for public health to play, that we'll see what happens.
Well, the thing that's been interesting as a hospital leader over the years, and John, you've heard this as I have over the decades, is, this assertion that for a long time there are too many hospital beds in this country, where we're overbedded, and we really need to be looking towards outpatient and that migration away from so much acute inpatient, and even moving now to hospital at home and some of these other solutions. And then that whole thing has been turned on its head the last 2 months, where there's the scramble, oh, there's not enough beds, and we're monitoring beds now in every community, and you can go on the website now and look at how many beds are available everywhere. But at some point, we're going to hopefully get back to that more upstream thinking, and how are we trying to really decentralize care out of the hospital as much as possible. And to do that, we'll have to make sure that people are on board with getting as far upstream of issues as they can as a society, because I don't think the answer is to continue building out more acute care capacity to catch everything that comes at the furthest end of the stream here.
Yeah, sure. The only thing I'd add to, as far as concerned, is funding. As we look at budget deficits federally or even the state-wise, our fear is that, one of the solution is that they cut Medicaid funding or Medicare funding. And it is a little bit potentially ironic that, we doing all this for hospital capacity and then turn around and look at the funding. So that's whether it's done or not, I'm not sure, but that is a real issue for us, because it's kind of like the right hand doesn't think of the left hand. You're doing all this for hospital support, but yet taking away potentially funding. So everybody's going to have to deal with that. We know that hospitals and healthcare systems have to play a role in that, but that's a fear that we have, is what does that mean? How does that translate down? Because the necessity of the size of the budget, whether it's federally or locally, but You know, I kind of ironically, I think that's a little bit ironic that, you know, build up and then take away, but, you know, I guess that's life, but that will be concerning because reimbursements are historically low on those two areas anyways, and take away. But I'm not sure how Riza, is that off base, or what do you think of that?
No, yeah, right there with you.
Yeah, well, and I think, you know, anything that the nation goes through, you know, COVID would be a great example, but other things like, you know, the last recession that we had in, you know, 07, 08, or 9/11, or, you know, these other historical things, you can look back on it and see, to your point, that we kind of gear up and overwhelm, and then what happens and what's the fallout. Because for a while we have this kind of, I think to some degree, collective understanding, maybe not so much in this crisis that we're going through as other ones, but it will be really interesting to see, because, you know, healthcare, and I was just thinking of, you know, we get past COVID, we'll have the same conversation, but then we'll, you know, return to the healthcare issues that you guys were dealing with before COVID, right? Which was, you know, probably workforce and Medicare, Medicaid funding, and then, you know, facilities and staff versus the need and things like that. But the effect of COVID on all of those issues that you're still going to have to deal with. And from the society, from the community point of view, we all want the best healthcare available, and we want to access it right now. And obviously that's the community need. So being able to balance that out is a huge challenge that you guys are faced with every day. So to describe it as interesting as we come out, it's probably an understatement. But do you have something else, Riza, to add on that one? We're down to about 5 minutes. I think when we came into this, John, you're like, yeah, I don't know if we can talk for a whole hour or not, but we almost burned through it, I guess. But I don't, you know, I appreciate the conversations. It's been a while since you guys were on, but you know, you're both really good at both kind of playing off each other and then describing what you're going through in the healthcare industry with COVID, because it's something that, you know, is on everybody's mind, and you guys are right there with your whole teams on the front line of it. And we always get into issues that I think the general public doesn't think about. So, you know, really appreciate your time today. And you guys both like to make a closing statement, and this time we'll start with John.
Well, just thanks for the opportunity. The more we can talk and get the issues out, the better. But it's still a lot unknown, and, you know, just know that the healthcare industry here in Tri-Cities is trying their best. Have good support from the Hospital Association and like Riza said, the local health district. We're all working together. We just can't solve everything right away, so we're working together to do that. And I think so far I've been really impressed with the community and how it's healthcare community and how it's reacted to stay available and open, so that we can treat the you know, people in the Tri-Cities and frankly in the region that come to us. So again, a big thank you to our staff, both in all organizations, willingness to come in as essential worker every day to the mission of taking care of those people. It means a lot, and our gratitude is to everybody, whether they're caregivers or people that support caregivers, and very thankful to that. We look forward to the day that there is a post-COVID conversation. So that would be great, Karl. Any predictions on that date?
Well, I'm going to give it at least a year, but it's probably going to be more like, I'm guessing 18 months. That's my prediction, and I'm just making it up. So
sure. Thank you.
Okay, Riza. Well, just thank you both for being on, but do you have any closing remarks that you want to leave us with? And then I'll try to give a sum up, because I've actually got a list of things that I wanted to just amplify what you guys both said today.
Just to thank you to the medical community for continuing to rally our team here at Kadlec, teams at Trios and Lords, and all the frontline workers from EMS, fire, police, everyone else who's kind of out there trying to support the health and needs of the community, the health district. And for the broader community also, just to thank you for all the recognition that we've received. It does mean a lot for our staff hearing those things and getting those kudos. So please keep encouraging your healthcare team members and community members and neighbors as you see and interact with them. And just my final thing would just be a word of encouragement to the whole community that there is light at the end of the tunnel with the vaccines coming. We've got to be patient a little while longer, and anything you can do this holiday season to be as responsible as possible about avoiding gatherings, keeping your hands washed, wearing that mask, all the things that we all know the drill now. It's just a matter of doing it. It's not rocket science, just common sense at this point. Just need to make it common practice.
You bet. No, well, again, thank you both for your time. Like I said, I've learned stuff. I learn things every time that we talk. A couple of my takeaways are for sure a huge thank you both to you guys and all your team, not just the healthcare providers, but the entire team that's dealing with COVID and the stress and fatigue that it's put on you. But thank you, for everybody that's there on the front line. And then I think really, if you're sick, don't have concerns about healthcare. There are different ways that COVID spread, but accessing healthcare in the correct manner isn't going to be more dangerous than it is. That you guys are ready to help people when they're sick. Don't wait till you're sicker to access healthcare. Go ahead and go. But if you do think you have COVID, try to access other ways other than just going to the ER room. And, obviously testing would be a first step. Accessing telehealth or any, remote services that you could before you go right to the hospital and go to the emergency room, because, that kind of takes the pressure off of what you guys are experiencing. And then, we're all looking forward to the vaccine. And then I think for everybody, just like Reza, you just said it the best, but as we go through the holiday season, just remember the things that we know and think about the other people that you're impacting. It's not just you, but it really is our whole community, even workforce related when we get into quarantines and things like that. So I think that's my takeaways today. So thank you both for your time this morning. We really, really appreciate it. Look forward to our next visit, which, we'll see when it is, but look forward to that post-COVID visit when we can, talk about the other healthcare
Thanks, Karl.
topics that you guys deal with all the time.
Thank you. Happy holidays. Appreciate it.
Yeah.
Thank
Happy
you.
holidays, guys. Have a great weekend. Thank you.
Good to be with you both. Take care.
Okay. You too. Bye.